Hello, yes, welcome to the Access Training presentation on emergency dental benefit for Title 19 members, 21 years of age and over. This is going to be a brief overview. What will cover the basis of what is considered a medically necessary dental service specified in the Access Medical Policy Manual. That'll be found under Chapter 310-D1 for dental services for members 21 years of age and over. Okay, let's go ahead and get started. Yes, so the Senate Bill 1527 established a $1,000 emergency dental benefit for emergency dental care and extractions for Access Title 19 members 21 years of age and over. This benefit is $1,000 per the member's contract year. As a reminder, the Access member's contract and benefit year is from October 1st to September 30th. This affects all fee-for-service members 21 years of age and older, both acute fee-for-service members, such as those enrolled in the American Indian Health Program, and tribal ALTCS members. Yes, please note that our tribal ALTCS members, that this is emergency dental benefit is in addition to the ALTCS dental benefit. ALTCS members receive $1,000 per member's contract year for medically necessary dental services. That'll be included with diagnostic, therapeutic, and preventative care. This means that the tribal ALTCS member receives $1,000 for their medically necessary dental services and another $1,000 for emergency dental services for each contract year. For additional information about the tribal ALTCS medically necessary dental service benefit, we do refer you to Chapter 21 of that Fee-for-Service Provider Billing Manual and to the Access Medical Policy, 310-D2, ALTCS dental service. Yes, so what is a dental emergency? Yes, in the Access Medical Policy Manual, a dental emergency is defined as an acute disorder of oral health with severe pain and or infection as a result of pathology or trauma. Yes, next, so what would be some examples of covered services in a dental emergency? It would first start off with emergency oral diagnostic examination, radiographs and laboratory services limited to the sympathetic teeth, composite resin due to the recent tooth fraction for anterior teeth, prefabricated crowns to eliminate pain due to recent tooth fracture only, recementation of clinically sound inlays on lace crowns and fixed bridges, whole cap direct or indirect pus filling, root canals and vital phlebotomies when indicated for the treatment of acute infection or to eliminate pain, episiotomy performed as a separate procedure for treatment of acute infection or to eliminate pain with favorable prognosis, immediate and palliative procedures including extraction if medically necessary for relief of pain associated with an oral or maxillofacial condition, tooth re-inflammation of accidentally avulsed or displaced anterior teeth with favorable prognosis, temporary restoration, which provides palliative/sedative care limited to the tooth receiving emergency treatment, initial treatment for acute infection, including but not limited to perioptical or periodontal infections and abscesses by appropriate methods, preoperative procedure, anesthesia appropriate for optimal patient management, and cast crowns limited to restoration of root canal treated teeth only. And we're going to continue on. So does this change anything for fee-for-service members? Members 21 years of age and older previously had no dental benefit. Previously, fee-for-service members would only be covered for medical and surgical services furnished by a dentist, only to the extent that such services may be performed under state law, either by a physician or by a dentist, and such services would be considered a physician service if furnished by a physician. That falls under AHC R9-22-207 and per the Access Medical Policy Manual 310-D1. In short, this means that if it's a service that a physician would normally perform, but a dentist could also perform, that could potentially be covered as outlined in the AHCCCS Medical Policy Manual 310-D1. Now though, members 21 years of age and older have the additional emergency dental benefit. Okay, and what does this change for the ALTCS and tribal ALTCS members? So before, ALTCS and tribal ALTCS members had $1,000 benefit per contract year to cover medically necessary diagnostic, therapeutic, and preventative care services, including dentures. These members now also have $1,000 per contract year to cover emergency dental care and extraction. So all summed together, members have $2,000 per year, but this amount is separated into two categories. So one amount being for diagnostic, therapeutic, and preventative care, and then the other would be for dental care and extraction. Yes, and just to know for everyone, just as an important side note, so any unused benefits by fee-for-service members, 21 years of age and older, or ALTCS members or tribal ALTCS members will not be permitted to carry over into the next contract year. So that does not cross over. Yeah, so next we're going to go ahead and discuss what is the purpose of the informed consent. So yes, this is a process where the provider would advise to the member, guardian, or designated representative of the diagnosis, proposed treatment and alternate treatment methods with associated risks and benefits of each, as well as the associated risk and benefit of not having this treatment. So the informed consents for oral health treatment include a written consent for examination and or any treatment measure, which does not include an irreversible procedure as mentioned below. This consent is completed at the time of initial examination and is updated at each subsequent 6-month follow-up appointment. A separate written consent for any irreversible invasive procedure, including but not limited to dental fillings, pulpotomy, etc. In addition, a written treatment plan must be reviewed and signed by both parties as described below, with the member, guardian, designated representative receiving a copy of the complete treatment plan. And just to continue off that, so all providers shall complete the appropriate informed consent and treatment plans for AHCCCS members as listed previously in order to provide quality and consistent care in a manner that does protect and is easily understood by the member, guardian, and or designated representative. This requirement extends to all contractor mobile unit providers. Consents and treatment plans shall be in writing and signed and dated by both the provider and the patient or patient's representative if under the age of 18 or is 18 years of age or older and considered an incapacitated adult as specified in ARS 14-5101. And just to continue off that, completed consent and treatment plans must be maintained in the member's chart and are subject to audit. So next we have charges to members. So next we're going to go ahead and continue to discuss when charges to members can occur for dental services rendered. So there may be occasions when an AHCCCS member requires emergency dental services exceeding the $1,000 dental benefit per contract. In these scenarios, billing of AHCCCS members for emergency dental services in excess of the $1,000 annual limit is only permitted when the provider meets the requirements of AAC R9-22-702 for acute members, and also under R9-28-701.10 for all ALTCS members. In order to bill the member for emergency dental services exceeding the $1,000 limit, the provider must first inform the member in a way that either he or she understands that the requested dental services exceeds the $1,000 limit and is not covered by AHCCCS. So before providing the dental services that will be billed to the member, the provider must furnish the member with a document to be signed in advance of the service, stating the member understands that the dental service will not be fully paid by AHCCCS and that the member agrees to pay for the amount exceeding the $1,000 emergency dental services limit, as well as services not to be covered by AHCCCS. The member must sign the document before receiving the service in order for the provider to bill the member. It is expected that the document contain information describing the type of service to be provided and the charge for the service. And just also as a side note, access may only cover up to the $1,000 limit for emergency dental services, regardless of whether or not the member signed the document in advance to the service. Yes, and to continue off of that, for ALTCS members, providers shall provide medically necessary services within the ALTCS $1,000 dental benefit allowable amount. In the event that medically necessary services are greater than the $1,000 limit, the provider may perform the services as set forth in AAC R9-28-701.10 and also R9-22-702 after the following notifications take place. Also, in accordance with AAC R9-28-701.10 and R9-22-702 charges to the member, the provider must inform and also explain to the member both verbally and in writing, in the member's primary language, that the dental service requested is not covered and exceeds the ALTCS $1,000 limit. If the member agrees to pursue the receipt of service, the provider must supply the member a document describing the service and the anticipated cost of the service. And also, prior to the service delivery, the member must sign and date a document indicating that either he or she understands that either he or she will be responsible for the cost of the service to the extent that it exceeds the ALTCS $1,000 limit. This would also just be a quick reminder. So in regards to prior authorization would not be required for emergency dental services. So a PA would not be required in this case. And this also covers our resources tab. So we highly recommend that you do pay a visit to our fee-for-service provider billing manual, and as well as our IHS tribal manual, and also our AHCCCS Medical Policy Manual. And that, everyone, would conclude the presentation for emergency dental services for recipients 21 years of age and over. We do hope that this material was helpful for everyone. If you do have any further questions pertaining to this training material, go ahead and feel free to send a message to our direct provider training inbox. You could go ahead and reach us at provider training, F as in Frank, F as in Frank, S as in Sam, at Arizonaaccess.gov. Again, that full email is going to be provider training, FFS, at AZAccess.gov. Have a great day, everyone.